or IVF treatment. So 𝗖𝒄𝒄𝒃 is intracytoplasmic sperm injection. In that we take a oocyte and inject the sperm inside the oocyte so that the fertilization is better and we get good number of embryos. There is a difference between IVF and 𝗖𝒄𝒄𝒃. In IVF treatment, we just take the oocytes and put it in a dish and don't inject the sperm inside. The sperms are just left over the oocytes. So as we all know, we commonly call this as test tube baby treatment or an IVF or an 𝗖𝒄𝒄𝒃. So test tube baby was a common term that was used for a long time. In that there are two treatments, one is IVF, another is 𝗖𝒄𝒄𝒃. What most of the IVF labs do is 𝗖𝒄𝒄𝒃, that is intracytoplasmic sperm injection. Is that a better treatment? Definitely yes. It is a better treatment where a complicated or a sophisticated instruments are used so that we get better number of good quality embryos. So let us know what is the process of 𝗖𝒄𝒄𝒃 and who has to get 𝗖𝒄𝒄𝒃 done. So what are the indications or who should be advised 𝗖𝒄𝒄𝒃? So this is first, whenever the sperm count is low or the morphology is less or the motility, the moving capacity of the sperms is less, or there is no sperms and we are taking the sperms from the testis, this was the first indication that 𝗖𝒄𝒄𝒃 was primarily advised. Later on, even for female indications like when there is low number of oocytes or the patient is more advanced age, that is more than 35 years, and when there is a polycystic ovaries or when there is a tubal problem or endometriosis, or there is a previous genetically abnormal child or previous recurrent miscarriages not having a healthy child. These are all the indications for which 𝗖𝒄𝒄𝒃 is done. So then what is the procedure? The procedure of 𝗖𝒄𝒄𝒃 starts with a baseline scan on second day of menstrual cycle, hoping that the previous month itself the preparation was done with all the basic investigations. Anyway, on the second day or third day when you visit the consultant, they are going to check all the investigations which is there, and there will be a scan which is being done, and you will be advised some tablets and injections. And from the second day the injections are put till the 6th day, and then the 6th day of injections you are called again for a scan. The scan is monitored. Once the eggs are more than 14 millimeters, there is addition of a injection. So this injection is called antagonist. This prevents the egg to prematurely rupture. Sometimes you will be worried. They are going on giving injections for 10 days. What if I rupture my eggs before they collect the eggs? So this is prevented by giving antagonist injections. So once the antagonist is given, then you are just called on the stimulation 10th day or 11th day. So there are going to be only 3 visits to the consultant, and there are injections which are very easily put. It's like insulin syringe pen-like injections which is not painful, and most of the patients take the injections by themselves. So it is a very friendly and comfortable injections to take. You need not worry about the injections. So on the whole, you will be taking injections for 10 days or maximum 11 days. And the final day, when the follicles are all beautifully grown, the trigger is planned. So the trigger is an injection which is usually timed in the night of a stimulation last day. So on the stimulation last day, you will also be advised some blood investigations to decide whether you will have an embryo transfer on the same month or the embryo transfer is going to happen after 45 days. So the blood test is done and the trigger is planned. Supposedly your trigger is planned at night 10 o'clock on a Wednesday. Then your egg collection will happen on Friday morning 9 o'clock. So exactly at 35 hours you are posted for a ovum pickup. So on the next day of trigger, mostly you will not take any investigations or any tests or injections. You will just do one small test at home. It's a urine pregnancy card test or an ovulation kit which is given according to the trigger injection which is being put. So the trigger injection can be a 𝗏𝒄𝒃 injection or it can be a loop agonist injection which is commonly called as 𝗍𝒂𝒃𝒄𝒃𝒄𝒃. So these injections are prescribed to you And depending on what injections is given for the trigger, the next day either pregnancy card or ovulation kit is given to you to make sure that the injections have acted properly. So there will be a in-charge doctor who is going to communicate to you and know that it is acted properly. So even if it is not acted properly, you are going to take a second sort of injection on the next day and you will have a beautiful eggs being retrieved. So you are coming on the day of pickup. So with the 8 hours of nil by mouth, that is, you don't take anything, even water by mouth, and get admitted. So you will be getting a egg collection done. It's going to be a 15 to 20 minutes procedure, and there is no injections in the backbone. It's only an injection which is given in the hand, a small injection which will make you sedate for approximately 15 to maximum half an hour. And the egg collection happens by a vaginal ultrasound, and it is not done by abdominal collection. There is no scars on the abdomen, and after you finish the procedure, very rarely there will be a mild discomfort or a mild bleeding or spotting which is happening. So the egg collection is done. You can see the egg collection process. So after the egg collection is being done, the oocytes are handed over to the embryology lab, where they screen the oocytes and tell how many are being retrieved. So then the patient is returned back to the recovery room, and after 2-3 hours the oral fluids and then the soft diet is started. And the same day of egg collection, supposedly you have come in the morning 8 o'clock, by 4 or 5 o'clock you are back home with your partner safely. So the next day you can do a mild activity, and the subsequent days you are all normal. If the hormones are normal and the oocytes collected are less than 24, then we post you for a fresh embryo transfer. So accordingly the medicines are given for 5 days, and after the medicines are given, either 3 days or 5 days, you're called back for embryo transfer. The embryo transfer doesn't happen with IV sedation or anesthesia. You can enjoy the embryo transfer. You can see the first photograph of your baby, and we will be talking to you, and under ultrasound guidance the embryo transfer is done. It's also a 15 minutes procedure, but in that you have to have a half filled or almost filled bladder so that the embryo transfer procedure happens with ease. The most important point that you have to note is the medications that are given after the egg collection should be taken properly if you are planned for an embryo transfer. But to note, the fresh embryo transfer has a 10% lesser chance of success than a frozen embryo transfer. So we believe in having a combined decision. So we are fertility specialists in A4, and the patients sit together and talk with the number of oocytes retrieved, with the previous history of either IVF done or not, and the number of hormone profiles that is done. With these combined factors, we make a decision whether to do a fresh embryo transfer or a frozen embryo transfer. Okay, the embryo transfer is done. After that, the medicines are given for 20 days. There are oral medications and there are also vaginal medications. There is going to be a staff nurse, a clinical coordinator, a dietitian, a psychological counselor who is going to explain you beautifully how you can tackle the post-embryo transfer period in a positive way. Exactly 14 to 15 days after the embryo transfer, the urine pregnancy card test, or better way of assessing is the serum beta HCG, a blood test which is done. Most of the patients will have our lab technician coming to your house for a home visit, checking your blood values. And don't get panicked and don't keep calling every 1 hour after the blood has been collected. Just stay calm and stay positive. There is going to be a time of 5 to 6 hours post sample collection. The reports will arrive only by 3 to 4 o'clock. So after that, the report will be informed to you. If it is positive, you are going to continue the medicines that will be given by the consultant again, and you will be coming for a scan 1 week later, so that we make sure there is single embryo or 2 embryos and it is all good. In case the embryo transfer has become negative, don't get distressed, don't give up. We will be mostly having surplus embryos, so we can have again embryo transfer maybe after a month gap, so that you also get settled with the medications. So this is all about our IVF cycle. So what are the duration of IVF cycle? If you are going to get an embryo transfer done on the same month, it's going to be a month process, a 30-day process. But only 25% of patients get a fresh embryo transfer done. 75% of patients get an all-free cycle. That means after egg collection, the patient has all the embryos grown till the 5th day and is frozen and kept, and they don't get embryo transfer on that month. So the duration of treatment for those patients will be the first 2 weeks of treatment, then they have a free period, they can go for outing, they can relax, they can enjoy, get fit and come back after 2 menstrual cycles. That is that month menstrual cycle, the next month menstrual cycle. So approximately 45 to 60 days later, they get an embryo transfer done. So in that frozen embryo transfer cycles, there are no injections, don't get afraid. There are only medications that are going to be given. After the medications are given, the embryo transfer happens in the same way as a fresh embryo transfer. And after embryo transfer, you follow the counseling, whatever is given to you, and 15 days later, the pregnancy test is done. So with the frozen embryo transfer, worldwide, the success rate is increased by 10 to 15% for a certain group of patients. There are 2 groups of patients who needs a frozen embryo transfer. One is if we collect more number of eggs, we call them as high responders. When the AMH is more than 6.8 or when there is more than 24 oocytes collected. The other group of patients is when the progesterone levels are more than 0.8 or there is an endometrial pathology, or if the patient has undergone a previous IVF failure, we want to give the best chances and best environment for the success. So this is what you should be knowing about an IVF or an ICSI cycle.